Hey, can you see me?
Yeah, can you see me? Someone walked right through me back there.
We might be dead. Are we ghosts?
How could I have done something like this to myself? What was I thinking?
I know, I was thinking I could have done something different too.
I wish I could have talked to somebody.
I think there are places that we could have went.
Can you show me?
Sure.
The ghosts travel further. Will we see more of the ghosts?
Yeah. We were able to use the concept of the ghost to do a bit of a walkabout to key services. And so they've gone on this journey and they actually become the eyes of the viewer. Welcome everybody to Where We All Belong. I'm Sam Sommers, coordinator of the local substance use outpatient clinic, and my co-host is Sarah Sullivan from AIDS Vancouver Island. For this episode, our guest is Brenda Bouttell, a nurse who works at the local nursing center, and she's going to talk to us today about community pain services. So Brenda, welcome.
Thank you.
So can you tell me what is that community pain services? Or community pain support?
Support services,
Yes.
that's great. We're actually part of an island-wide program that we're linked with the Victoria and Nanaimo pain programs, the hospital-based programs, but we're really fortunate in this community that we have community pain support programs at the Comox Valley Nursing Center. And we're really there to really support and empower people and educate them and provide them with some needed information that they need to learn how to cope with a chronic pain condition. Yeah.
And Brenda, who is the community-based pain program for, and how would someone access it?
The community pain support program is for adults. Generally, we have not been seeing children, so adults usually 17 or 18 and above who are living with chronic pain conditions, so things like osteoarthritis, migraine headaches, endometriosis, fibromyalgia. Lots of people seem to be experiencing fibromyalgia, and oftentimes after work-related accidents or motor vehicle accidents, people are left living with a persistent pain condition. So not people who have cancer pain, okay? We're generally providing care to people who have chronic persistent pain, or pain that's lasted longer than 6 months and is often associated with some other chronic health challenges.
Okay. So for viewers who live in the Comox Valley, where would they find this clinic? And what are your hours of operation?
Yeah, the Comox Valley Nursing Center is located at 615 10th Street. It's actually right behind the fire hall on Cumberland Road, so that's an easy place to know where it is. So it's on the corner of 10th and Grieve. There's ample parking there, so it's easy, and there's no charge for the parking at this point, which is really helpful for some people who find it difficult to pay for parking in some situations. So, and it's all one floor, and there's electronic doors, so it's really easy for people to access and get into the center. The center's open Monday to Friday, 9 to 5 p.m. We're closed at lunchtime from noon to 1 p.m. Our drop-in hours for people who would be newly coming to the center are currently Monday, Wednesday, and Friday from 1 to 4 p.m. So if somebody was new coming to the center and was coming on their own steam, that's when they can come and see one of our drop-in nurses. Other than that, we have a number of other healthcare providers or community service agencies that can refer people to the center. So physicians, mental health services, certainly AIDS Vancouver Island, or any other agency. So the access is really easy. It's not difficult for people to access services. We really try to make that a seamless kind of thing for people.
That's great. So this program, this is one of the episodes of, is called Where We All Belong, and it's about substance use services in the Comox Valley. So how would you say the community pain support program fits into that?
I would say that although we're not specifically a substance use program. There's many people that have a chronic pain condition that medications have been part of that program, and it's an important part, but it's certainly not everything to how to live with a persistent pain condition. So we provide a number of different programs or services to really educate and support people and to assess people living with a persistent pain condition. So a number of the community, one of the community resources is we have a chronic pain support group that meets the third Tuesday of every month at the nursing center from 1:30 to 3:30, and it's facilitated by Heather Devine, who's from the People in Pain Network, as well as one of our nurses, Gail Timmons. So that's education and fellowship and providing people with a lot of self-management information. We also have a relaxation program every Thursday afternoon with a registered clinical therapist, so it's Diane Davies, who leads a relaxation program. So many people who are living with persistent pain, it's really challenging, and learning how to do some stress management skills can be really helpful in learning how to cope with a chronic pain condition. Another program we run is an educational program. It's 5 weeks. It's called the Chronic Pain Educational Series, and it's 2 hours every Monday for 5 weeks, and we have members of our chronic pain management team, which is we have a kinesiologist, a therapist for mental health, a pharmacist, and a dietitian who really take 2 hours to explore those particular aspects of a person's life and how they can promote health within chronic illness. So what are the kinds of things maybe they could be doing to improve their general health, which oftentimes will help cope with a chronic pain condition. So that's 3 of the sort of community education. You don't have to be a client of the nursing center. You can just register and participate in those. The other 3 services that we run is we do one-on-one individual health consultations with people. So that would be a one-on-one, several appointments with one of our nurses to really do a comprehensive health assessment and really kind of get to the bottom of all, and then create an individual care plan. And then once that's done, that's shared with the client, but as well shared with the family physician and any of our other chronic pain management team members. So if that person felt it would be helpful to see the pharmacist to review their medications and to get an individual counseling session on that, we can share that information with the pharmacist, and that pharmacist comes to the center and works with that person one-on-one on their medications. We also have 2 GP pain consultants, so Dr. Phalo and Dr. Graves, who are available to see some of our clients who maybe are really quite complex, and perhaps the physician is wanting some support around the management of that person's chronic pain. And we link a lot with mental health and addiction services. So many of our people are, experiencing depression and anxiety and are being seen by mental health staff or participating in a lot of their programs. So hopefully it's a really integrative approach so that people feel like it's seamless working with different people in the different agencies. That's what we're hoping for.
That brings me, I really wanted to ask you, I'm aware that many people attend the service, and I just wondered, do you have any thoughts about why does it work?
I've been there 22 years now, and it was interesting because when we first opened the doors of the nursing center 22 years, the first person that walked through the door had fibromyalgia. Was a young woman. We all looked at each other and went, what's that really? And the whole understanding of chronic pain has really, there's a much better understanding of what's going on in this situation. So I think what works is a real ease of access, I think a real relational practice. So I think people feel comfortable coming to the center. I think we've done a really good job of, our staff are fabulous at creating meaningful relationships with people, really working from that person's strengths and really hopefully building on supporting them and having a better life in spite of having chronic pain. So I think it's all of those qualities that have really made the center an easy place to access. We really try to minimize the bureaucratic stuff and really emphasize people really taking on their own goals and supporting people in what it is they want to create in their lives and become more healthy and more well.
Well, thank you so much for joining us today, and you shared so much information that could really transform people's lives. So thank you so much for being with us.
Thanks, Brenda. And viewers, we'll run some information, some website information and things like that. So get your pens ready.
Thanks, you guys.
Okay. So Tanya, are there any other initiatives that connect people who may have substance use problems or other health-related, substance use health-related problems that we haven't touched on yet? People that maybe don't have a doctor or...
Sure. Well, there's also the Health Connections Clinic, and we are an NPGP primary care clinic that's in the nursing center. That incorporates also the primary care nurses. And we work as a team to provide primary care to those who haven't fit well within the medical system. And it could be those with addiction, but it also could be those with other kind of issues, maybe mental health, maybe not. But again, for those who really just don't fit well within the traditional medical model. And so we have physicians working twice a week at this clinic, and then I'm there 4 days a week.
Okay, so it's for anyone who really isn't connected and has had difficulty getting connected.
With a family doctor,
With a
yes.
family doctor, yeah. Okay.
Yeah.
Okay. Thank you.
You're welcome.
Welcome everyone to Where We All Belong. Today our guest is Mary Fuhr, and she is with the 21 Canadian Forces Health Services Centre, Comox.
Mary, if you could imagine a compassionate community, what would that look like?
I think I can imagine one, and it's a community where we look at our brothers and our sisters as regardless of any of the differences and their, the life circumstance, as being similar, that they're afforded the same kind of opportunities, that we don't put barriers and obstacles in their way, that we try and remove those. Like for me, that's so the idea of not walking past people and overlooking them, and sort of not having people on the fringes of our society for whatever the issues are, that we bring them into our society, that we don't separate. That we, I think a compassionate community to me is one that is accepting of differences and, vulnerabilities as well as strengths.
Great. Could you tell us who your service is for and how would they access it?
The services are primarily for active duty service members, regular force and reserve force, and essentially it's those that are in the valley right now. Sometimes we get people who are on course and they're receiving services in another part of the country, and they can come and access services here. But we primarily serve whoever is in this area.
So what kind of services do you provide? What happens if someone contacts you?
We provide psychosocial supports. We provide assessments for mental health or addiction treatment. We provide intense we look at the level of services that the service member is going to require, and we try and match that with a real sort of broad suite of services, which are initially include screenings, assessments, education as well. Then it could be life skills training. It could be one-on-one individual counseling. It can be group counseling. It can be medication. In combination with their doctor. We put in place, sometimes in the more, when the match seems to be that they need more intensive inpatient treatment to manage either withdrawal or some behavioral things that are going along with that, and just give them a longer period of abstinence and stability, we can send them to private residential treatment centers. And then on follow-up, when they're released from that, we do a follow-up aftercare. And typically it lasts about a year. And we do groups. We certainly encourage them, a connection with the community, because we live in the community. So, and the peer support and that strength and being challenged and with their peers is really important as they learn to sort of live life. And I'm trying to think what else. It's actually a very comprehensive, and we can revisit some things. We can use, if there's issues around, emotional regulation that could be part of we can do some very unique and individualized care. That's one of the strengths that we have, is we can individualize it. We have access to resources. Yeah.
So what are the hours that your services open? Like, if hours that are open that somebody could connect and begin working with you? And is there a cost?
The hours are 7:30 to 3:30, Monday to Friday. It's a clinic. It's a home-based clinic. So typically that's when they get access to us. There is no cost to the service member, but it's part of the suite of their health care, and so it comes out of that type of budget.
So this interview is part of a series called Where We All Belong, about the local substance use services in the Comox Valley. How would you say that your mental health and addiction services on the base fit into the continuum of services in the Comox Valley, or do they?
Well, they do for the service member. I mean, we're restricted to who we provide services for, but given that our service members are part of the community, we meet those needs, in a very specific way. And we also tap into the community resources, and again, they live in the community, and as well as, 12-step programming, individual counseling in the community, or some of the programs at the hospitals, things like that. We really try to utilize the resources that are here, because I think that the potential for recovery is higher when it is a recovery based in the community and not just done in isolation. So, yeah.
So why do you think your service works? Or I guess another way to say that is, are there those things that you do that you go, yeah, that was really good. I'm glad we provide that. What are the things that you've seen that appear to benefit people?
There's a number of things. I mean, I feel very fortunate to be working in an organization that's so well resourced and with such flexible and innovative leadership. And that is part of it, being able to collaborate in a multidisciplinary team environment, and, having very quick access to that. We have psychiatry, we have psychology, we have social workers, myself, mental health and addictions, and as well as the physician element and nurse practitioners. And I think that when we all come together, and physio, sometimes addiction is, tapped into chronic pain, so there's a number of reasons. So we have almost immediate access to that. And then we also have, resources within, across Canada. There might be an idea that comes from another base that we're able to implement here. So I think that we're not working in isolation. We can get quick access to services for clients. It's certainly, comparable to what normal civilians have to go through to get maybe a psychiatrist appointment or psychology and things like that. Those barriers are eliminated, and that makes the ability to work with people and offer and not be so restricted quite unique. It's well-resourced, and you've got a motivated population that our role is, and part of our goal is to have them return to work healthy. And when issues come up, and they will come up for people, that we're able to mobilize all those resources to get them moving and get them back to work, functioning in a healthy, safe way. So I think for that's a real sweet piece as a provider, a clinician, to be able to offer that.
Well, that is really inspiring, and I'm sitting here having lived here almost my entire life, and I've learned quite a bit about what you offer, so it's I'm very inspired, so thanks for sharing that with the viewers.
Oh, right on.
Is there anything else that you would like to share with our viewers about what your services are?
I think what I'd like to sort of say is that I think there's more of a movement now towards being more inclusive in the community. One of the things about living in the valley is how many people have never been on the base and don't even know what's being offered on the base in terms of medical care. And I think that it would be really great for the community partners to be able to come out, and we encourage that. Come on out and meet us, and have us come out and meet you, so we can see where we fit and what we can do to augment. And sometimes because we also have an element where we can work with couples, their families are affected. And we can provide supports for that. And when we talk to the community partners, we are able to identify some of those. Is there a gap in service? And maybe offer that. So those are some of the unique things that, just having the ability to provide.
So on that idea of sort of reaching back and forth, how would people be in contact with the base and find out what services and connect? Would they contact your clinic, or is there a phone number we can offer?
Well, there is. I mean, what anybody can do, and we try and reach out. Like, that's one of our goals, is to do outreach. Anybody could call, and if anyone's interested in learning more about mental health and what we offer on the base, they could call our department, and the extension on the base is 8148, and they could speak with our mental health team leader, who is Lieutenant Navy Dale Vincent. And I've worked for the military for a number of years, and what I've known is that each one of my managers has been delighted to speak with community members. That's welcomed, and so we say, come on in, and it's just a call or an email, and just not being, those gates don't mean don't come in. It just means there's a gate.
I have to say, I certainly enjoyed connecting with you and Dale Vincent on the phone the other day. And we're in the middle of brainstorming something, and it just feels really great. So, yeah.
Oh, that's nice.
Yeah.
It's nice meeting you and talking to you.
Thank you so much for participating. It adds a whole new depth to the program to make sure that all the community members are reflected in the services that are provided.
Oh, that's awesome. Thank you.
Thank you.